You know, Stone County Hospital has been around for over 50 years. And a lot of people think this is probably just a little bitty old hospital out in the country. Well, it's a lot more than that. Matter of fact, a lot of people don't know that has a full radiology department with anything that you can imagine. Matter of fact, Stone County Hospital was the first hospital in the state of Mississippi to get a CT scanner of this magnitude, which is something they're very, very proud of. Now, right now we're talking to emergency nurse practitioner Brian Gibbony. How are you, Brian?
Fine, how are you doing?
I'm very well, thank you very much. And this is true. I mean, everybody thinks small hometown, great bunch of people up in Wiggins and Stone County Hospital, but they don't realize the things that are available to them in the field of radiology.
Yeah, this 64 size scanner that we have is one of the first state-of-the-art scanners in the state of Mississippi, and it allows us a lot more definition per slice. Digitally, it's 128 images per slice each time the scanner spins around. It's much faster than the traditional scanners. A study can take about 30 to 45 seconds versus 4 or 5 minutes on the older scanners. So patients in, they're out, and our radiologists that read our studies for us have a lot more definition to give us more enhanced studies.
Now, exactly what are you looking for? I mean, there's MRI, which y'all have here. Of course, regular radiology center, as far as X-rays, things like that. The CT scanner, what do you actually look for with something like that? If a doctor gives someone an order for a CT scan, I know at first, why do I need that? What are you looking for with a CT scanner?
Well, CT scanners can look at a lot of things. They can look at soft tissues. The majority of the time, we're looking at large organs. Inflammation or bony fractures.
So these are different conditions that may constitute getting a CT scan.
They are trauma, any kind of surgical conditions in the abdomen and pelvis. Warrant CT scans.
Well, anybody that likes to watch sports or everything, you're always hearing, like watching professional football, player gets hurt, oh, they're going off, they're going to get a CT scan. And these are different things they're looking for. Right,
they're looking for those really small fractures. They're looking for some soft tissue injuries, although MRI gives better definition of some of those that we hear about on TV.
Okay, well, you mentioned MRI, and you have an open MRI here. Tell us about that. What is an open MRI?
An open MRI is just an MRI that has a bigger tube or a bigger tunnel. It's not as confining around the patient, so they can feel less claustrophobic while they're getting
I was just saying, I have a friend of mine that is very claustrophobic, and she had to have an MRI done once, and she's like, can't do it, but the open MRI was a big relief for her.
A lot of patients find it much more comfortable.
Now, you have, of course, the MRI center here, unit here. Do you have a mobile MRI?
Yes, it's a mobile MRI.
Oh, it is a mobile, okay. So, you also offer bone density scans. Is this something that is more towards older people? Because we think, we get, the older we get, osteoporosis, things like that having to deal with.
The bone density scanner helps us diagnose and quantify how much osteoporosis somebody has. So, the most common person for that is going to be, ladies that are older than 45 or 50 are going to be the most common, but that's not to say they're going to be the only ones. There's a large range of patients that suffer from osteoporosis. Well,
most of the advertisements that you see on TV are for people with osteoporosis are directed towards women.
Most of them. They need the direction more than others. They tend to have more osteoporosis as they get older.
Is osteoporosis, can that be hereditary? Or is it just something that comes with age?
It can be. It just comes with age.
So now, as far as if we need to get someone needs to get a CT scan or an MRI, I guess it's something they get an order from their doctor?
They do. They just get an order from their doctor. One of our physicians here at the Stone County Family Medical Clinic or any primary care provider that they see, they bring their order into the hospital, and we can take care of their needs right here in Stone County.
And that's another one of the great things. A lot of people think you've got to go to Gulfport or all the way down to the coast, or you might have to go to Hattiesburg or Jackson to get a CT scan or MRI scan, because again, they wouldn't think, well, a little hospital in Wiggins wouldn't have something like that, but you really do have a lot of advanced equipment here.
We have all these services available right here in Stone County for them.
And they can go to the clinic, whether the clinic is here in Stone County, or I know that you have a clinic office in Poplarville as well.
That's correct.
So they can go to any of those clinics for those.
Yes.
So this one here, as you mentioned, this is the CT scan. Was it just lift them up?
It does. It raises up.
And we don't have it actually turned on because it would wreak havoc with the camera equipment and everything. But patient very comfortable. And this is, again, the CT scan is looking for soft tissue things, bones.
Yeah, organs, bones, some soft tissue. And then it just scans them in.
And while you're getting her position, the MRI, of course, it's moving slowly. The MRI scan, what is the difference between the CT and the MRI?
The definition of an MRI is a lot greater for soft tissues, spinal cords, ligaments, in joints, as well as tumors for cancers and things like that.
Yeah, I can recall several years ago I had a TIA. A lot of people surprised about that, but I had a TIA, which is a mini stroke, and I went through an MRI because they had to do that, I guess, to check, see what.
Yeah, a lot better tissue definition in the MRI, even more so. So during the scan, the actual scan takes place in about this length of time for a whole chest, abdomen, and pelvis.
Right.
And the patient's finished.
And that's it.
That's the entire scanning process.
Wow. You didn't have time to read a book or anything like that. And of course, I know when you do the MRI, when you go get an MRI done, they usually sometimes give you headphones or something, and you got to stay perfectly still. But this is absolutely
no time
amazing.
To get uncomfortable.
No time. Don't have to worry about that. Well, again, if you want some more information about it, you can call Stone County Hospital, any of the clinics. If you live in the area, of course, you do have to get doctor's orders, correct?
That's right.
You just can't come in and say, I got sore muscle, I need a scan.
That's right.
Doesn't work that way. Thank you so much. Appreciate it. The information on that, and to our lovely model here for doing this for us. But it's amazing, and the different things that they do have available to patients here at Stone County Hospital and the Stone County Clinic as well. So if you'd like some more information, again, you can come here if you need to see one of the doctors, or if your doctor gives you an order for an MRI, an X-ray, or a CT scan, they can do it right here in Stone County Hospital. So again, thank you very much for the information. Really a lot of great things going on here, and we'll be back with more things to tell you in later editions of Healthy Living South Mississippi regarding all the wonderful things at Stone County Hospital.